Hi, everybody. Good evening and welcome to the Finding You podcast. I'm Dr. Brad Reedy. Today is Tuesday, June 16th, 2026. Tonight, I'm going to be talking about psychodynamic therapy and how Freud and Jung were right in so many ways. Even though the theory has evolved since then, it's become much more complex and it's being supported by the empirical data. I want to talk about sort of the contrast between these modern American theories that focus on symptom reduction and what Freud and Jung discovered about the psyche all those years ago that created this field of the talking cure. Before I get into that, let me talk about our housekeeping items. If you're interested in attending one of our Finding You intensives, our flagship program, the next offering in person is August 5th through 9th. We have an online option available June 26th through 28th. This was something we started during the pandemic, and I was very skeptical about its power, its efficacy. And I found after the first day of doing the first one that this was a wonderful option. It's about a third of the cost and about half of the time, and you don't have to travel. So if you're interested in doing this work, you want a deep dive, and time and money is at a premium, that online offering is available June 26th through 28th is that offering. August 5th through 9th is the next in-person intensive. If you're looking for an intensive for a couple, for a family, or any other configuration, you can contact us for our private intensives. You can contact us for our support groups. We have support groups once a month for the alumni of our programs. June 20th is that next offering. If you're looking for a coach or a therapist who can help you with the kind of work that I talk about, you can reach out to us through our portal on our website or email us for any of these issues at info@findingyouprograms.com. That's info@findingyouprograms.com. Now, the reason that we're not hosting an intensive in July is because I'm going to be with my daughter in New York at the Omega Institute, July 12th through 17th in Rhinebeck, New York. So if you want to do something that is experiential, that is interactive, and maybe the Finding You just isn't the right time or the right thing for you right now, this 5-day workshop for around $500 is a wonderful, wonderful value. And again, you get community, you get interaction, you get experiential activities. So if you're interested, go to the Omega website at eomega.org. That's eomega.org. Go to their workshops tab and then click on the Audacity to Be You. I'll be facilitating with my daughter the same workshop later in the fall, September 27th through October 7th at the Art of Living Retreat Center in Boone, North Carolina. So if that timing works better for you, it's the same price, same format. But if that price, or excuse me, if that location is a better fit for you, then the Boone, North Carolina option might be yours. If you're interested, go to the Art of Living Retreat Center website at artoflivingretreatcenter.org. That's artoflivingretreatcenter.org. Again, click on the workshops tab and then the class that's there. Now, with that, let's get into tonight's content. I wanted to start off as I get sort of detailed into what we mean by psychodynamic therapy, psychoanalytic therapies informed by psychoanalysis. I want to set the stage for really what is more of a way of being with somebody than is a technique. I shared this in the Journey of the Heroic Parent in an effort to borrow from the analytic wisdom in our parenting journey. It's from a quote by a man named Stephen A. Mitchell, who wrote the book Influence and Autonomy in Psychoanalysis. He wrote, "The emphasis is not on behaviors, but on rigorous thinking, not on constraints, but on self-reflective emotional involvement, not on the application of general truths, but on imaginative participation. This suggests a very different sort of technique. The discipline is not in the procedures, but in the sensibility through which the analyst participates. There is no generic solution or technique. There is a great deal of disciplined thought in the skilled practice of clinical psychoanalysis and continual complex choices." So more than anything, it's a way of thinking. It's bringing your self to the work. It's bringing your soul to the work, your humanity to the work. And there's no one way to do it. One of the things I've been thinking about so much, because I've been thinking about the interplay between faith and therapy, is this idea that so often we look for rules, we look for boxes to check. We want to know exactly what to do. And we want an authority figure to tell us the right thing to do. And what that is, that desire for a should, is sort of a defense against the experience of living in an ambiguous, uncertain mystery, right? It's the defense against that. So instead of having to grapple with something that seems so much more complex, ethereal, is I want rules and I want absolute directives. But this work asks something deeper of us. One of the things I thought about this week while I was running the intensive, which I was overjoyed to participate in, was that we're going to meet you where you're at. And even if you have an instinct that goes against what my theory might teach me, I'm going to make myself curious and available to what your approach, what your idea has to offer. See, the fundamental idea in psychodynamic theory is that the symptom is something that we make meaning with, not something that we look at and try to make it go away, to make it disappear or subside. We think that the symptom is the most important information we have about what has gone on for you in your past and in your present day life. So we're not inclined to kind of strip away the defenses, to confront you. We don't think it noble to call the client on their stuff. Rather, we understand that love is, and human connection is the medicine. And we sit and we wait until the client can let down the defense because they feel safe. Can lower their resistance, not because they should or a good client would do that, but because there's no reason for the resistance or the defense to be in place, because there's no threat in this kind of psychotherapy. So when I talk about what to look for in a therapist, I'm talking about a therapist who's flexible, fluid, who is less married to a technique or approach than they are interested in connecting to the client and understanding and hearing the client. When I was in graduate school during my master's program, so this is a long time ago, early in my training, I got a job at a local clinic that was supported by my university, where they treated children who were victims of significant, severe physical and sexual abuse. And the treatment that we practiced that was indicated was play therapy, because play is the language of children. So without much training in this area and with little experience, I entered into the play therapy room. And it was videotaped as a part of my student process. So I would show the videos to my supervisor, and he would patiently, but I could tell he was frustrated, tell me to slow down and to stop intervening, to stop being in control of the session. And he would tell me to go back to assessment. Over and over and over again, he would say, stay in assessment. And what he was trying to say to me, I know now, I didn't understand it then, was get interested in understanding them rather than fixing them. But in understanding them, something magical and profound happens. The client feels heard and validated and safe. And from that new position, they can then unwind and unravel the symptoms, the adaptations that they've used to survive up to this point. So we don't tear away the defense. We don't confront the defense. We don't consider it noble to challenge and confront clients and make them uncomfortable. We don't see ourselves as coming into the session. I heard one therapist say one time when I was sitting on a panel, she said, oftentimes I just tell my clients the truth, even in those early sessions. And she said with some curiosity, she said, they often don't come back, but at least I told them the truth. And I thought to myself, when I was waiting for my turn to go, I thought, who does that telling them the truth serve? If you can't understand where the client's coming from and meet them in such a way that they feel that the warmth of your presence, your compassion, your non-judgment, so they don't want to come back, who is exactly benefiting from that? See, resistance isn't something that we meet in a client and seek to get through or over real quickly. we think that the resistance tells us something about your background. So instead of, for example, the slogan of our program is not come and trust the process, right? Put your doubts and your skepticism, your distrust to the side. We assume that if you come with skepticism and doubt, that you have a good reason. We assume that might be because in the past, when you've had similar kinds of experiences, it did not feel good to you. It did not go well for you. So instead of saying trust the process, we say come as you are, and we'll meet you there. So again, when I talk and when I teach in these broadcasts about things that I might do or that I train therapists to do, it's not so much a doing thing. It's much more of a being thing, of a way of being. And if you come into the session with judgment, that will get communicated somehow, some way. That energy will make its way to the client. But in contrast, if you come with love and non-judgment and curiosity, it doesn't matter to a certain extent what you do, because that will come across to them. Same with our children, same with our spouses, same with all of us. And so that's why skills have their limits, their limitations. Techniques have their limits. The procedure is not the magic. It is the space that the therapist or the parent, if we're talking about parenting, but in this case, the therapist, it's the space that the therapist creates for you, which is a reflection about how they're holding you in their mind in such a way that you feel safe, that you can discover your own truth. When I say that Freud and Jung are right, it doesn't mean that they were right about everything. I always make the joke when people are critical of Freud and Jung and imagining that the principles, the ideas are outdated, when in fact, as I will show you tonight, they are basically the head of the where all of the wisdom comes from in our therapeutic practices, right? It's spread throughout that. But when I say that to them, I said, well, first of all, criticizing Freud and Jung is like criticizing the Wright brothers because they didn't have Wi-Fi on the first flight at Kitty Hawk. We have, of course, have evolved flight, air travel since then, but we give credit to those who made something out of nothing, who found a secret, just like we give credit to Bill W. and Dr. Bob in the 12 steps. They discovered things intuitively that now the research shows and supports is helpful. Things like fellowship, things like learning to address your shame and so forth. So they were not right about everything. It has evolved. The specifics have been revised. The drive energy, what pushes us forward, the psychosexual stages, some of Jung's idea about metaphysics, we've learned a lot since then. And we've added to this equation. But what they were right about was the basic architecture of the human spirit, the human soul, which we call the psyche, which is the Greek word for soul, right? Soul is not a ghost, as many people might imagine in psychoanalysis or the original use of it. It is the idea of the essence of you, who you are, who you were before the world told you who you should be. So what we learned from Freud and Jung was about the architecture of the psyche, that there's a large reservoir of unconscious material, or in modern theory, we would call that implicit memory. That's what the researchers would call it today. There's this large pool of energy, far more than we can imagine or even see, that is fueling our decisions, our behaviors. If it were just the conscious material, which is often compared to the tip of the iceberg, I don't think we would need therapists at all. We could read a few books. We could all agree on the basic ideas about what it means to be a good human and just kind of follow that. But it's so much more complex than that. But one thing I often say to people about psychotherapy is, for it to be most effective, the client must be open to the idea that there are things beyond what they know consciously that are affecting their life, that are driving their behaviors. And when we create a kind of a safety, a safe place, a container that is devoid of threat, then that unconscious material will more easily come to the surface, because it's been put there because the person thought it was shameful or unacceptable or would cause people to not love them, reject them, abandon them. The mind has depth, and we are moved significantly by what we don't see. And that the meaning in the symptom is much more important to pay attention to than the symptom reduction itself. Every psychotherapy that looks to treat the root causes has inherited Jung and Freud's basic models without even knowing it. Like I mentioned, to say that they were right is not to say that they were right about everything. It is to say that they saw something true about the human soul that no one else had named before. So let's talk about psychodynamic theory for just a moment. First of all, the dynamic means that forces are in motion. It's a minefield of competing pressures, wishes, fears, defenses, pushing against each other far beneath the awareness. So there's a conflict in our soul. There's what I believe society tells me I should do, and there's what I want to do viscerally. Right? There's this longing that I have for something transcendent, some kind of meaning. And then there are the rules and the constraints that society places on us that hold me back or hold me away from that. And the negotiation that we all go through to kind of reconcile these two competing drives is what drives our behavior. The behavior is the visible result of this invisible negotiation. So in psychotherapy, in modern psychodynamic informed therapies, we don't even look at the way that the client feels about us. If they are angry or upset, we don't think that that's necessarily something that creates an impasse in therapy. We think of that as fuel to drive the therapy. What did I do? How did I miss you? What did I replicate that was familiar from your past that triggered you? We remain curious. 4 main premises underline Freud and Jung's work. First of all, that the unconscious is real. That most of mental health, most of our mental life, our emotional process runs beneath our own awareness. I wrote last week in a post a poetic comment that I made that said, I'm out looking for secrets, specifically the secrets I keep from myself. I was talking to a good friend about this not too long ago. He was talking about how amazing it is in our dreams that we can be startled or scared by another character when we are the ones casting that character. How can somebody surprise us in a dream, startle us in a dream, if we're the ones that put that character in the position to startle us in the first place? And I shared with my friend, knowing what I know about psychodynamic theory and therapy, I said, that's just our brain showing off. It's showing us that there are things that we're not aware of, that we're not conscious of. And again, just like in real life, in the dream, the task would be to listen to the monster, to listen to what the warning is, to heed the message and the wisdom that they have to offer us. But our instinct is to run away. That's the defense. That's the resistance. Our instinct when we get scared, and that makes sense, doesn't it, is to put up a barrier or a wall. The next way that they were both right was that the past is present. Early experiences, especially during the critical early years of our childhood, organizes our psyche, maps our brain, wires our brain, and impacts how we love, how we're resistant, how we interact, how we move through the world today. The third thing that I've already mentioned several times is that symptoms have meaning. One of the benefits or one of the things that psychedelic assisted psychotherapy offers us, psychedelics really encourage meaning making. Our brain, the things that we see, take on dreamlike imagery, dreamlike. It becomes a waking dream during psychedelics. And that is the unconscious running free and creating a scenario, a story that speaks to the conflict that we're experiencing deep down inside, the repressed emotions, experiences, parts of ourselves that we have been told to hate. So symptoms have meaning. We don't attack the defense. We honor the defense. We believe that the defense was the thing that kept you alive and safe. It has, of course, outlived its function, but we honor it before we do the work. In fact, by honoring it, I was going to say we honor it before we do the work to try to reduce it, but honoring it is what reduces it. Understanding how it served us, when it served us, becoming conscious of the unconscious material that it's suggesting to us is how we help it to go away. And what that does, different than symptom focused, right? Just theories that just try to regulate the nervous system, is it addresses where it originated. It addresses it at its root, not at its presentation. And the fourth way that they were different, even than what most people think today, is that the therapeutic relationship is the medicine. I, as a therapist, then become the tool. I am the instrument. How I show up. I want to explain this to you because as a parent, this is so profound. When I talk and teach about tools, I tell parents that the number one tool that you have to offer in this parenting journey, this parenting challenge, is your nervous system. If it's regulated, if you're taking care of yourself with your own work, your own therapy, both in moments of acute worry and crisis, but also over the long run, if you bring a regulated, calm nervous system, a not afraid nervous system to the child, that trumps everything else, essentially. The child gives you their pain, their anger, their sadness, their hurt, their trauma, their wound, whatever it is. And psychodynamic theory says that the parent then takes in the child and what they're saying and metabolizes it due to the greater resources that they have available, the experience they have, the wisdom they have, the maturity, kind of the life that they've lived. They take in the child and metabolize the child's emotions, feelings, distress through the resources that they now have as an adult. And they feed back to a child a sense that the child is okay. But if the parent doesn't have a regulated nervous system and doesn't know this project, they often will take in the child's fear or anger or distress and through their own sense of inadequacies, they'll reflect back to the child that something's wrong with you. You're too sensitive. You're overreacting. You're guilty of a thinking error, right? We make the child the problem because we are inadequate, not up to the task of holding space for the child. So the therapist then becomes this kind of replacement parent. Therapy becomes the childhood that you did not have, and the therapist becomes the parent that you did not have. And when you engage a therapist like the ones that understand what I'm describing, it feels dramatically different. It feels safe. The therapist is happy to be wrong. The therapist is happy to be quiet and wait for you to come up with the insight or the conclusion or the interpretation. And when the therapist makes a misstep, as they inevitably will, because all therapists are human, the apology comes easily. Instead of what often people will do who haven't done this deeper work, they'll make the client wrong. You misunderstood my intention. That was your depression talking. You think I'm like your mother or father, and I'm not, right? That's the defense. But the therapist couches their defense in these kind of clinical terms, and so the client is left no better off, maybe even worse off than they were before therapy. They're now having an experience which confirms their earliest and greatest fears, which is maybe I'm the problem. So psychodynamic theory is taking these different influences, these different pressures. I have to fit in society. I have to make a living. but I want to go out and just play all the time. I want to drink myself silly. And the ego is trying to figure out how to negotiate, to find an acceptable way for everybody to be just satisfied enough. So the first half of life, and I'll talk about this, is really about developing an ego, the ability to function in life and to kind of balance these dynamic forces. And later on, I'll talk about the second half of life, which is letting the ego go, which is where a lot of you are at. These are the four premises that Jung and Freud shared before they diverged. The first is the unconscious mind. Most of what drives us is not available to introspection. We are not transparent to ourselves. We keep secrets from ourselves. In the past, it was a radical claim. The I is not in charge of the house that it lives in. Now, confirmed by cognitive science and empirical research, we talk about implicit memory, automatic processing, priming, attachment patterns, which we never consciously choose. Even when I said this to somebody today, somebody said, my partner told me that I'm choosing to have a negative attitude. I'm choosing to be afraid. And I said, it's not my experience, never has been, that I'm consciously choosing my feelings. And so this kind of positive psychology that says you can just choose happiness, I think everybody who's been through hell, some kind of hell, like most of you have been, knows that it's not that easy. It's not that simple. That there's something that serves me in not choosing happiness. Perhaps it is that I had to read the room growing up, because if I misstepped, I would experience my father or my mother's rage or terror. So I'm always anticipating, always perceiving things as a threat so that I can prepare and not be caught off guard. In therapy today, we listen for what the client is not saying as much as what they are saying. We listen to when it seems like something would naturally typically cause somebody to be angry and the client is not angry. We get very curious about that. In fact, often, I just said it this week, I was feeling a tremendous amount of anger when somebody was telling me about abuse that they'd experienced. And they responded back to me as, I don't feel angry. And I said, I know, I can tell. Maybe that's why I'm feeling it. Maybe it was something that needed to be protected with your anger, and you were not allowed to. Anger was not acceptable. In your family, you had to be happy, for example. The single most consequential idea in modern psychology is this idea that the unconscious exists. While Jung and Freud disagreed about what is in the unconscious, they both agree that it exists and that it runs most of our life. Implicit memory is another way of talking about unconscious in modern day research and theory. The second principle that they shared was that the past is in the present. We carry our history into the therapy room. Early relationships lay down the template for how we attach, defend, and love as adults. The context, the shape of the context, the flavor, the temperature of the context is how we understand our symptoms. What did we need to show up as? What did we need to get rid of? What was not allowed? So when the client shows up and we sit and we listen carefully and clearly, we start to hear the story of their context. Back then, the childhood is not over, Freud and Jung postulated. It is encoded in the cells and reenacted, replicated over and over again in virtually all of the relationships that we have. Now we talk about attachment research and developmental neuroscience and how they can make these kinds of patterns measurable, not just speculative. We can see the way that the brain fires, and we know which parts of the brain do what tasks. And so we can start to trace how the brain can be, for example, hijacked in a fight or flight situation. And how in such a threat, the person resorts to similar patterns of behavior. And we call those patterns a diagnosis. In the therapy room, we see the present-day patterns and we read them as old solutions that are still running. So when somebody comes in with a pattern and says, I want to get rid of it, I always encourage them to slow down. I want to get rid of my anger. I want to get rid of the fact that I was doing this symptom or that symptom. And I tell them to slow down. We'll get there. This is the work. But what did it make you feel like when you did that? What were you defending against? I don't use those words necessarily, but what was it relief from? What were you hoping for? What were you trying to avoid? See, it's not about coming into therapy and saying, here's what my mother and my father did. If it were that easy, anybody could do it. But it's more like your trauma shows up in the reactions you're having on your way to the session, in your car, with the Uber driver, or somebody who cut you off in the grocery store. We watch your big emotions, your big feelings, and we find the pattern where they are being triggered. And we ask questions like, I wonder if it was you did not feel seen when you were young. And in this case, where you did not feel seen or you were underestimated. Did that remind you of something? It's the same as in 12 steps when they say, if it's hysterical, it's historical. If the reaction seems disproportionate, rationally speaking, to a specific stimulus or event, then we have a guess that it comes from your history. If you're annoyed about a certain trait in a person that you're in a relationship, we trace that back to understand, where does that fit in your own psychology? Was that something you were not allowed to feel or exhibit as a child? You were taught to be compliant. You were taught to be the one that doesn't have the problem because you had a child that you had a sibling that had a mental health or a physical health issue that demanded so much of your parents' time. That you had to be the non-squeaky wheel, for example. When a pattern looks irrational now, ask what it solved in the past. This is the seed of attachment theory, of object relations, and of all this modern trauma-informed work that we're hearing about these days. The third shared principle between Freud and Jung, the meaningfulness of the symptoms. Suffering is a message. Suffering is a message. It's not just noise. So we look to understand. We do psychedelics to find meaning. We're trying to connect our suffering to something greater than ourselves, to help it make sense. Anxiety, compulsion, depression, even self-sabotage are adaptations. They once made sense. Then the symptom was a compromise. The best available solution that your ego could summon to the equation, to an impossible bind that you were in. Now, we start to understand the function of the symptom. That's what we call functional analysis. In internal family systems, we put these parts of ourselves that have been repressed, and we give them names, roles, and we talk about how they serve us, how these different roles serve to help us adapt to a situation that felt overwhelming or we felt alone in. And we honor all of the symptoms and its purpose. In the therapy room, we ask what the symptom is and what it's trying to tell us before we ask to remove it. The symptom is not a problem to be removed. I wrote in one of the books, it is a messenger to be understood. It's a solution that has outlived its usefulness, not a malfunction. Remove it without understanding, and it tends to relocate. It comes up somewhere else in the garden. The relationship. The essential healing happens between two people. And this is important. This is important for all of you because the wound happened in relationship to another person. We use a lot of psychodrama role-playing. We call it role-playing or psychodrama light because it doesn't follow, again, it doesn't adhere strictly to the rules of formal psychodrama, but it's role-playing. Empty chair, for example. Because we want to understand what it was like for you to be in relationship to the big people, to your siblings. How did you feel when you were 8 or 10 or 12? Have a conversation. Let's go back in time and visit your parents from that time period. Have a conversation with them. Tell them what you were feeling. See how they respond. And their responses tell us how you were dented, how you were bruised, how you were missed, how you were hurt. So if the way that we were wounded is sort of the source or the root of our mental illness patterns, our adaptations, then it would only make sense that the healing would often be found in relationship to somebody who is very different. My therapist talks about traveling to other countries as a way to understand your childhood. She says if when you go to another country, you get really clear about the context you came from because you can see it now. Right? The fish is the last one to discover water. We can't see or describe the soup that we were cooked in, the air that we were breathing. It's invisible to us. But it becomes more clear when we get out of the context. Out, the fish can know water when it knows what not water feels like, or what not water is. So when I told my therapist for the first time that I was angry with her, and she responded with, "Thank you for telling me. I'm honored that you would trust me. Given what I guess about your childhood, I'm sure this didn't go well in the past. So the fact that you would tell me is really meaningful to me." And I realized I've never been in a room with an adult. I knew why she did what she did theoretically. I had a PhD at the time, so I was not confused. Still hurt, still didn't like it, still was frustrated, but she didn't use that theoretical justification that I even knew about to defend herself because the matter was settled for her. She didn't care about my praise, my admiration, my acceptance or my lack of acceptance toward her. She had sorted that out by herself. So mom and dad, if we're going to extrapolate, what do we learn and how do we apply it to parenting? Go do your work so that your child can be in the presence of an adult who doesn't need to be good or right because they settled the matter for themselves. The relationship is the instrument. The cure does not come from advice, not even skill teaching, although that happens. It comes from what is lived out between the therapist and the client. Back then, Freud talked about transference. Jung's talked about mutual transformation. The relationship itself is data and medicine. Now, the therapeutic alliance is the most robust predictor of outcomes across every model. The therapeutic alliance is the most robust predictor of effective outcomes across every therapeutic model. So in the therapy room, we pay attention to what is happening between us right now. Donald Winnicott, a great contributor to attachment theory, said, "It is a joy to be hidden and a disaster not to be found." There's a bridge here from Freud's transference to the modern alliance literature. Alliance predicts outcomes better than technique. They do research where they give clients to people with various techniques, and two things predict it. Number one, does the therapist believe in what they're doing? If the therapist is assigned a model that goes along with what they believe, then it works better. And how does the therapist describe the relationship between themselves and the therapist? Those are the predictors, not what is said. And that's why this kind of psychology that I'm talking about today transcends EMDR, brain spotting, even somatic experiences, which are largely, in some ways, nonverbal. This is the kind of glue, the kind of temperature in the room that makes the bigger difference than anything, than the technique itself. Resistance and defense. Freud and Jung both saw it as a self-protective mechanism. So again, you strip off somebody's armor. See, when you're a new therapist, you get kind of drunk with your own power. The earlier, the better. Meaning, the less educated you are, the more you get drunk with your own power. And you love to diagnose and analyze people, especially your spouse. It's handy in a good fight to have access to clinical language. You could just ask my wife how that is. So instead of doing that, we understand that the resistance and the defense is something quite sacred, actually. It's the child inside of the client saying, "I feel scared. It's not safe to know these parts of myself that you're suggesting exist. I can't be the problem because I was taught as a child to be good. So your exploration and looking for kind of what I'm carrying around that's a part of the problem is absolutely threatening." And that's why I call the book The Journey of the Heroic Parent, not because I expect parents to be these fantastic mythic beings, heroes, the hero archetype. I'm not talking about that. I'm talking about the heroic effort that it takes to look inside of yourself. Joseph Campbell talks about in mythology, there's often an ominous, foreboding land that the hero, the protagonist, has to travel to. Into the forest, into the sea, into the cave, into the mountains. All of these places are metaphors for the psyche, for going inside of you, for walking into an Al-Anon room and sharing, for going to a therapist and having the crazy courage to tell the truth. And the risk is that you're taking, the risk of telling the therapist your truth is that they're going to do to you what your parents did to you and tell you how you're wrong for thinking and feeling what you're thinking. So even really traditional talk therapy is still experiential if we understand and look at it through the lenses that I'm describing, that Freud and Jung gave us. We protect ourselves from knowing what would otherwise overwhelm us with the resistance. Defense is intelligent, not stubborn. Defenses are intelligent, not stubborn. Resistance is not an obstruction. It marks exactly where the pain is. So I think new therapists think if I can just get past the resistance, I can get to the real goal, the good stuff. And I always say the resistance is the thing. It's just another version of shame. And that's virtually all we're treating is shame. So resistance isn't the thing to get past to get the therapy. Resistance is the thing that we're treating. Your lack of trust, your skepticism, your reservation, your compliance. One of the classic forms of resistance is cooperation. Being the good client. So when a client comes in and is trying to be a good client, I feel that. I can sense that. They think that they owe me their progress, that they owe me their gratitude, their appreciation for what I'm giving. And you don't owe your therapist anything like that. You do not owe your therapist your progress. And if you feel this pressure, this impatience, that's from their background. Resistance is not an obstruction. It marks exactly where the pain is. Sounds like Rumi, doesn't it? Where Rumi said, these pains are messengers. Listen to them. Anna Freud, after her father's death, cataloged all the defenses. And they remain a core to all theories today. We use so many words on a daily basis that Freud and Jung added to, but Freud invented. We respect the defense in therapy today before we ask it to relax. In fact, by respecting the defense, it tends to relax. Resistance is not the enemy of therapy. It is the doorway. So we learn to reframe resistance as protective wisdom, not non-compliance. Where the client pushes back hardest is usually where the wound is. We don't bulldoze defenses. We understand what they guard. And we sit and we wait. Compassion, I wrote, is the foundation of self-awareness. Self-compassion. Because without self-compassion, we would never be willing to look to be able to see the truth about ourselves. So, when you find a therapist who doesn't recoil at your symptom, who doesn't get frustrated, frightened by your symptom because they have enough resources to metabolize that, we start to have a different relationship with those symptoms. How do you learn self-compassion? You first have to experience it from somebody else, according to this theory. I wrote once, become conscious. Become more conscious. Everything else will fall into place. But to become conscious, first you must learn to love and accept the parts of you that people in your history found unacceptable. And the best way to do that is hang around different people. So what the therapist brings is their own consciousness. What the parent brings to the parent-child relationship is their own consciousness. And that's why self-work is the first ingredient in a secure attachment. And self-work is also the most important part of a therapist's approach in this manner. In this kind of therapy, you can only take the client as far as you've gone. Because if they bring up something that you haven't addressed or that you've avoided, it will trigger a reaction in you, just like it would with anybody who's avoided that. And your reaction will be communicated unconsciously. Lastly, insight and working through. Change is slow. It is much slower than anyone wants to think it is. I think it's the greatest barrier to really effective therapy is how slow the change is. It gets repeated. It comes in small steps. The epiphanies are exciting. The aha moments are intoxicating. The new skills feel empowering. But real change takes a long time. And that's why the more enlightened one becomes, the more one realizes what an idiot one is. Understanding is necessary, but not enough. Change is rehearsed, repeated, and lived over time. Back then, it was called working through. Insight must be remet again and again before it holds. I tell some people bump up against this experience in therapy where they think the therapist is getting sick and tired of me. I'm going to quit. I'm tired of complaining about the same thing. But really what they're afraid of is that the therapist is going to be tired of it, because that sense that they're expressing comes from their background too. But if you have a therapist that's trained like this, they will tell you, you can bring this up 1,000 times in a row. These things take a long time. I'm in no hurry. And I know it's unpleasant and I know it's hard. But I'll sit with you until it's healed. Now we talk about neuroplasticity and how habit research confirms this need for repetition and how repetition reshapes our neural pathways, our psyche in essence, the wiring of our psyche. And in the therapy room, we expect relapse and return. Growth is not linear. I've shared the story that my therapist sat with me with one specific big question that I had, big dilemma that I had for 10 years before I was able to walk through the door I needed to walk through. And I am so grateful that she was patient, that I didn't sense any impatience in her. Because if I had, I probably would have abandoned the project altogether and still be back there. Insight is the beginning, not the cure. Working through is the slow rehearsal that turns understanding into change. And this is why depth work takes time and why setbacks are a part of the path. So Freud lived from 1856 to 1939. And what he gave the field of psychology is a method for listening beneath the words. He was the builder of the method and the map. Even though his theories have been revised and improved upon, his clinical moves are in daily use in most people's therapy. It's called sometimes the talking cure. And it's a way of being, not just a theory, but it's a way of operating. So when I talk about where people talk about trauma and where it comes from, understanding our trauma doesn't fix it. Understanding where it came from doesn't fix it. It's this repetitive exposure to an empathic, patient, loving, non-judgmental other that changes us. Free association, it wasn't like you had to talk about any specific thing in therapy. Whatever comes up. So many people, I see the entire continuum of clients. Some people come with notes. Some people come with one question. Some people come not knowing anything. So many great sessions start off with a client saying, I don't know what I'm going to talk about. And then by the end, we're talking about something so deep. It doesn't matter. We'll get there. The frame of therapy is a reliable, neutral, confidential space. It's a condition that makes the context safe so that you can go deep, so that there's no threat. You see, all defenses are a response to a threat. And if you try to tear somebody's defense system away, they're just going to build a more solid, more formidable defense system, or they'll launch an offensive attack. The therapist, just by their very presence, by the way they engage, offers meaning to the clients couldn't see alone. Like Jamie says, my therapist, what was bad at home now in therapy is nothing. And the possibility that that is true changes everything, changes our relationship to ourselves. Freud's enduring practical invention is a procedure, a way of being. The client can talk about just about anything. The frame makes it safe. The consciousness and awareness of the therapist offers a different vantage point, a different way of seeing things. And there are many therapists who still reject Freud, but use his method every day. I love this quote from Winnicott. He said, psychotherapy is not just simply about making clever and apt interpretations. By large, it is long-term, giving the patient back what the patient brings. If I do this well enough, Winnicott says, the patient will find his or her own self and will be able to exist and to feel real. It is only in recent years that I have become able to wait, to avoid breaking up the natural process by making interpretations. It allows me to think how much change I have prevented or delayed with my lack of patience. If only we can wait. The patient arrives at understanding creatively and with immense joy. And now I enjoy this joy more than I used to enjoy the sense of having been clever. The principle that it is this: it is the patient and only the patient who has the answers. Freud talked about the drives that he was talking about that were in conflict in our bodies. The superego is the shoulds from the culture. The id is our sexual base desires. And the ego is the negotiator. The classic example is that Freud suggested that we all have a kind of a violent drive in us. So American football might be a way that somebody handles that. Boxing, hitting a heavy bag, chopping wood. The ego finds an acceptable way to express this raw drive, this push for satisfaction. While it's not literal brain anatomy, it's a metaphor for the conflict. It's our appetite versus our conscience. Freud said once, the ego is not the master in its own house. It's a model. It's a way of understanding the energies that move within an individual. Defense mechanisms are the protections we put up against the threat. It's how the mind protects itself from when it cannot yet bear. Like I said, it was cataloged and extended by Anna Freud, his daughter, and it is still central to every clinical formulation. Some examples: repression, pushing the unbearable out of awareness; projection, seeing ourselves in other people, reacting to other people because of the parts that we've rejected in ourselves; denial, refusing to see the reality that overwhelms us; reaction formation, becoming the opposite of what we fear feeling. You know, when you're a little kid and you say that girl over there or that guy over there is stupid, but really you have a crush on them, that's reaction formation. Sublimation is channeling the impulse into work or art or service. One of the ways that the ego can help get out these feelings that are socially unacceptable is through art, through activity, through service, through work. Even the music that our children are listening to. Remember that I've said this before. One of the purposes of our children's music is it's intended to scare us. Not consciously, of course, but it's meant to be an assault on our value system. And even when your children are listening to music that you think on the surface, why are they listening to this trash, this garbage, this vile language, this misogynistic, this anti-authority, this violent stuff? It's because it gives them a sense of release, right? So instead of simply getting rid of the music, we want to listen to what is it serving. I don't know if you know this, but I read about this, and you can research this on the internet and find this this story. One of the shooters in Columbine actually wrote a story in his English class that was pretty close to what he ended up executing a short time later. And when the assignment was turned in, the teacher, instead of seeing it as a cry for help, thought it was wrong and bad and inappropriate, passed it up to the leaders in the school. They called in the parents. The parents then punished the child, lectured the child. Nobody thought to listen and to understand. And I don't blame them. It was a horrific event that he wrote about in his creative. But just think, and I'm not saying this would have done anything, but just imagine, just as a metaphor, what if they had responded differently to that? What if they saw the symptom, the unacceptable art, as a message, a messenger? It quite possibly could have prevented a great tragedy. Rationalization, that's one, if you are educated, if you are a good thinker, rationalization is one that we use all the time. We tell ourselves a story where everything makes sense. One of Freud's most durable atheoretical gifts that every school uses is this idea of defenses. Defenses are adaptive, not pathological. The work is to make them conscious so they become choices. J.D. Gill explained, speaking of therapy in the container we create, safety is not the precursor for treatment. Safety is the treatment. Repeated exposure to a safe adult changes your nervous system. Transference is how the client treats you, how the client feels toward you, kind of their attitude toward you. The client unconsciously relives old relationships through the therapist, the withholding parent, the demanding judge, the longed-for rescuer. Freud first saw it as an obstacle to therapy. Then he saw it as the very thing that makes change possible. These old patterns become visible, tangible in the sessions. They become workable, live, and in the room. And then the therapist has feelings back. We call that countertransference. And the therapist's reactions now today, we understand, not something to be avoided like it was thought of in the early days, but something to make meaning out of. There are two types of countertransference. One is diagnostic, and that tells you about the client. The example I told you the other day where I felt anger at a story that rationally should have caused some anger, but the client couldn't feel it because they weren't allowed to feel it. That's diagnostic countertransference. Or personal countertransference, something from my background, something that triggers my history. So the therapist's reactions become a tool, not a failure. They are the relational substance. Intersubjective therapies are built on this insight, this awareness. Naming the live patterns between us is one of the most powerful moves. Telling the client how you're feeling, how you're reacting, the sense that you have in your body. It starts to give them an awareness that they wouldn't otherwise have. Arguably, Freud's single most clinically alive discovery. The old relationships becomes editable because it is happening now with the therapist. Countertransference is information, not contamination. Dreams and meaning. The interpretations of dreams, Freud famously said, is the royal road to the unconscious. Dreams, as Campbell explained, are a private myth, and myth is a public dream. So these symbolic, artistic stories that we tell communicate so much truth. Even though your dream might seem crazy when you look at its symbols on the surface, we know that all of it is true. Same with myths or religions. Campbell said all religions are true if taken symbolically, metaphorically, and none of them are true if taken literally. It's the same thing with our dreams. Our unconscious, our ego is asleep, resting, and our unconscious gets to play and put these things into the mind. So even a scary dream has tremendous value. Even a scary psychedelic trip, because psychedelics kind of hamper the ego's ability to kind of modulate, to kind of control and negotiate things. Even a scary trip, if processed and integrated correctly, can be as valuable or as enriching to the person's psyche as a wonderful blissful dream or psychedelic experience. It's not that every dream is a code to crack, but it's that the psyche speaks in images. And what might seem senseless and meaningful once we learn its grammar, once we learn how dreams work, we can kind of decode them. Symbol, metaphor, and the meaning of the seemingly trivial, the slip, the Freudian slip, the joke, the forgotten name, all become legitimate clinical material. The client that forgets to come might be in a process of resistance. Avoid generic symbol dictionaries for sure. Those parts have evolved. It's a moving process. Dream interpretation is something you do with the client. And you use the client's wisdom to help you understand what the symbols mean. The durable insight here is that the mind communicates an image in metaphor, and trivial material is meaningful. And of course, Jung added to dreams and symbols, and I'll talk about that in a minute. We repeat what we don't remember, what is not conscious. What is not made conscious returns as fate. Jung is often reported to have said, we reenact the same relationships, crises, and choices. Like I often say, the fact that your ex is an alcoholic is interesting. The fact that your ex is a narcissist is interesting. The fact that your ex is a borderline or a personality disorder, all of those things are interesting. But what's really fascinating, what's really compelling to me is, why did you marry a narcissist or an alcoholic or a borderline? Because that is where the gold is. And in some ways, you married them because at some unconscious level, it was familiar to you. It felt like home. We unconsciously recreate old, even painful situations, seeking mastery over what was once overwhelming to us. It explains the why do I keep ending up in this situation that brings so many people to therapy. The modern echo, the language used today, is that trauma is reenacted. Intergenerational patterns and the schemas of later therapies all descend from this. The clinical heartbeat of the past lives in the present. This is the engine behind intergenerational patterns and modern schemas. The popular line about the unconscious becoming fate is a paraphrase of what Jung taught. The courage that it takes to go inside is tremendous. That's why I call it heroic. Freud taught us to take seriously what we would rather not know about ourselves. Like I often quote from the Dead Sea Scrolls in the Gospel of St. Thomas, verse 70. If we bring forth what is within us will save us. If we do not bring forth what is within us will destroy us. Freud explained that extended awareness and agency into territory of the unconscious is necessary. It's not about repression. It's about reclaiming choice, becoming an agent in our own lives. Freud mapped the basement, and Jung later opened the upper floors and the windows and expanded on this. A couple of quotes as I wrap up part one, because this is going to be a two-parter. I haven't even got to Jung. Part of the business of psychotherapy is to discover and create alternate experiences for thoughts, feelings, attitudes, and beliefs, Jamie Gill says. This is undertaken in the service of freeing people to be able to re-experience themselves in a safe but different context. The virtue of talking to an empathic and accepting person who has a different base is that it quickly illuminates one's own. And I referred to this quote earlier. The experience of seeing one's base from a different perspective can be profound. One way this happens is by allowing ourselves to be honest and open with someone who does not react or even feel the way our parents did. For example, what was very bad at home is now nothing. This difference in experience allows for the realizations that things could be different. One's assigned position in one's past is not necessarily one's assigned position in the universe. All right, I'm going to do part two on Thursday and go and talk about Jung. I'll do a little recap of Freud and then go into Jung. If you don't know about it, our Inner Circle has launched. That gives you access to these live broadcasts every time. Also, It gives you access to 2 broadcasts per month that are not available to the general population. It's a small subscription of $10 a month or $100 a year. You can cancel at any time. My 3 books, The Journey of the Heroic Parent, The Audacity to Be You, and Stay in the Room, my co-authored book, are all available wherever books are sold. The audio version of Stay in the Room will be out soon. Look forward to that. If you want to work with me this summer or fall and you can't quite make it to an intensive, but you want something interactive, July 12th through 17th, my daughter Emma and I will be at the Omega Institute in New York, in the Hudson Valley in Rhinebeck. Go to eomega.org, click on the workshops tab, and click on the Audacity to Be You workshop to sign up there. If that timing doesn't work for you, the exact same workshop will be taught at another location at the Art of Living Retreat Center in Boone, North Carolina. Just go to their website, artoflivingretreatcenter.org, click on the workshops tab in the class there. That's September 27th through October 2nd in Boone, North Carolina. If you're interested in doing a deep dive, if you want 6 months to a year's worth of therapy in 5 days, that's my estimation. And I'm being conservative. I believe on that. The Finding You Intensive is that offering. June 26th through 28th, we have an online offering of this workshop. It's about a third of the time a third of the cost and about half the time. Plus, you don't have to travel. If you want the in-person experience, October 5th through 9th, that's our kind of flagship program, Finding You, August 5th through 9th. For all other inquiries for private intensives for couples and families, if you want to find out about how to get to our support group, if you're an alumni, our next one being June 20th, or if you're looking for a coach or a therapist who can help you in this work, go to our website and contact us through the portal or email us at info@findingyouprograms.com. That's info@findingyouprograms.com. I'm going to do part 2 of this broadcast this Thursday, the 18th at 6 p.m. Mountain Time, talking about psychodynamic theory, how Freud and Jung were wrong. And I'm going to be talking about Jung, how he expanded on Freud's theory, and also how they differ. So I look forward to that. I hope this was helpful, even though it's very theoretical and technical. I hope it gives you a glimpse and you can borrow some of the principles talked about tonight to help you in your relationships and your everyday life. I hope so. Or it can help you in understanding what therapy is and how to make the most out of it. Because I believe an informed client is a client who has a greater benefit, a greater advantage over one who is uninformed. All right, folks. Thanks for joining me. I hope this is a helpful point of contact for and on behalf of the people that love you and the people that you love. Thanks for showing up and doing your work. It makes all the difference in the world. Have a great evening. I'll talk to you Thursday night. Take care. Bye-bye.